Okay, you ready? Hi everyone, hello, good afternoon everyone. You are tuned on to Dr. Gilead Show. I want to welcome you back again to our show today. Dr. Gilead Show, we are on WBGR Radio and also on Facebook Live. I'm Dr. Theo Swala, your host. Today we're going to talk about tobacco-related disorders, but we are on WBGR Radio. If if you want to call, you can call on 301-429-9247, 301-429-9247, and you can also send us a message on our Facebook page. You can make a comment, or you can also ask a question, and we'll be willing to answer your questions. So today we're talking on tobacco-related disorders. But before we start, as usual, we like to say, please do not make a diagnosis of yourself or of someone based on what you hear on this platform. Dr. Gilead Show, the producer, the host, and our guests cannot be held responsible for what you do based on what you hear on this platform. It's always good to consult a doctor who can make the appropriate diagnosis and give you the proper treatment. Tobacco-related disorders. Now, this is a cluster of behavioral, cognitive, and physical characteristics, and that occur in persons who are regular cigarette smokers or users of other tobacco products. So it's a cluster of symptoms, both cognitive, behavioral, and physical. Now, nicotine is the active ingredient in tobacco, and we know that nicotine has effect in the brain, but we're going to talk about that later, what it does. And the effect gives people who smoke some pleasurable feeling. Now, chronic nicotine exposure results in tolerance and physical dependence. When you chronically smoke cigarette or chew tobacco, you develop tolerance to it, and you also become physically dependent on it. What are the sources of tobacco that we smoke? Tobacco is used as cigarettes. It's also chewed as tobacco leaves, and that is those are the two basic components. But also it could be some people grind it and sniff it or snort it, as the case may be. So that is more common in African countries and also in Middle Eastern areas. What is the prevalence of tobacco use? It is said that cigarettes are the most commonly used tobacco products. 90%. 90% of tobacco is used as cigarette and is smoked. Now, in the United States, 21% of adults are current smokers. 21% of adults, 18 years and above, are current smokers. Also, 22% of U.S. population could be classified as former smokers, but 57% have never smoked. That is the statistic. 57% have never smoked. Now, it is known that 14% of males, as well as 12% of females, smoke cigarette, and the gap or the ratio is wider in developing countries. But in developed countries, it is getting closer and closer. More women are smoking as well as men. Now, by age, 18 years, it is said that by age 18, 20% of U.S. adolescents smoke monthly. And the prevalence of tobacco use in pipes and cigars is less than 1%. So some people do pipes or cigars, that is very minimal. But it's known that above age 18, most adolescents, by age 18 actually, most adolescents would have smoked cigarette, and they continue to smoke more as they grow older. Now, when you talk about races, among the different races in America, Native Americans and Alaska Natives smoke more than any other race. 23%. 23% of Native Americans and Alaska Natives smoke cigarette. Among the Caucasians, about 14%, and African Americans 10%, Hispanics about 6%. So we can see that cigarette smoking is something that cuts across all cultures, all races, and groups of people in the world. Tobacco use disorder is a known psychiatric disorder. Is diagnosed based on the symptoms given under the DSM, the Diagnostic and Statistical Manual of Mental Illness, which is the Bible of psychiatry. So that is what we look at to make the diagnosis of any mental illness. And in DSM-5, if you have 2 or more of the following symptoms I'm going to list, you can be diagnosed. If you've had any of those in the last 12 months, you can be diagnosed with tobacco use disorder. Number 1 is taking larger amounts or taking tobacco over a longer period than as intended. Some people set out, let me just get a little smoke, and suddenly they find themselves smoking more and smoking longer than they had planned to do. Number 2, if there is persistent desire or unsuccessful efforts to cut down or control how much you smoke, that is another criteria for you to be diagnosed as having tobacco use disorder. Number 3 is spending a lot of time in activities necessary to obtain or use tobacco. And there are some people who they could smoke all day. I know people who smoke about 3-4 packs of cigarette, and that is, if you smoke 3 packs of cigarette, that is, a pack is 20, and that is about 60 cigarettes a day. If you smoke 4 packs, that is 80 cigarettes a day. If you're spending a lot of time in activities necessary to obtain or use tobacco, you are one of those who could have the diagnosis of tobacco use disorder. The other criterion is spending a lot of, is craving or urge or strong desire to use tobacco. There are people who, if they are in a meeting and they have not smoked 1 hour, 2 hours, they must jump up to go smoke a cigarette. They have a lot of craving or urge or strong desire to use tobacco. Another criterion is using tobacco in a fashion that results in a failure to fulfill major obligations at work. Things like failure to do your work continuously because you need to run out in and out to go smoke a cigarette. Another one is continuing to use despite having persistent or recurrent social interpersonal problems from the effects of tobacco. Now, things like having arguments about tobacco use. There are people who, once you talk about the need to cut back on how much cigarette they smoke, it is a big thing. It becomes a big argument. They're ready to fight. Such people could be diagnosed with tobacco use disorder. Now, some people, another criterion is giving up or reducing important social, occupational, or recreational activities because of tobacco use. So there are people who cannot take certain jobs because in that job you're not allowed to smoke. Or they cannot be in some social gatherings because they cannot smoke, because they will not have the opportunity to get out and smoke a cigarette or go chew some tobacco. Or for those who sniff it or snort it, it looks messy, but they can't do it. So they cut out such social, occupational, or recreational activities. Another one is continuing to use in conditions that are physically hazardous. So people who smoke, even in hazardous situations, that is a very strong criterion for diagnosing you with tobacco use disorder. And for example, there are people who, even though they are tired, they are sleepy, they smoke cigarette on their bed. That is hazardous. Also, I have seen people who, because they have certain illness like chronic obstructive pulmonary disease, COPD, they have their oxygen tank hanging on their neck and still they're smoking. Forgetting that that oxygen tank, because of how highly inflammable oxygen is, the body can catch fire. The house can be set on fire because they have oxygen tank right there. They're laying in their bed. They are on oxygen because they have difficulty breathing, and they're still smoking a cigarette. That is a strong, strong indication that this person has tobacco use disorder. Another symptom is continuing to use tobacco even though they have knowledge that they have persistent, recurrent physical or psychological problem. So you see someone who has lung cancer, someone who has a lung disease, they're having difficulty breathing, but yet they're smoking. So they continue to use tobacco despite the knowledge that they have persistent or recurrent physical or psychological problem. There are people who have depression, mood symptoms, insomnia, and still they smoke. Even though they know that once I smoke, I get hyperactive, my thoughts are moving fast, I can't wind down, but they still smoke. They can't sleep. I went to visit someone, and his neighbor, he says his neighbor is up all night smoking a cigarette. So these are some of the major problems, the major symptoms for which someone could be diagnosed with tobacco use disorder. What are the risks? What are the risks of tobacco use? It is known that almost half, that is 50%, of all cancer cases in the U.S. are linked to tobacco use. 50% of all cancer cases are linked to use of tobacco in any form, smoking or chewing tobacco. And it's also known that tobacco use is the leading cause of death in the developed world. And this could be from cancers, from cardiovascular disease, like heart attack, congestive heart failure, or even chronic lung diseases like COPD, chronic obstructive pulmonary disease, where the airways are narrowed and the lungs are no longer as expansible and pliable as they should be. So you see the person breathing in very short, taking short breaths. It is hard to breathe. That is COPD. And also, it's known that secondhand smoke on family members or co-workers can also affect them. So it is known that tobacco is the leading cause of death in the developed world, and that is in Scandinavian countries, US, and in European countries. It's also known that tobacco use is the most common cause of preventable death or disease in developed world. Preventable is the key word there. So tobacco use is the most common cause of preventable death or disease in developed world. We also know that the leading cause of death in the US in 2000 was tobacco, and that is about 435,000. 18% of total deaths was caused by tobacco in different fashions, whether it is cardiovascular disease, whether it's lung disease, or cancer, or other forms of diseases. So we can see that tobacco use is really, really a very risky behavior. But the question is, why do people still use this substance? Now, it is known that people also develop tolerance. Tolerance is said to be developed when people have need for increased amounts. When you have need for increased amounts of tobacco to achieve the desired effect. Also, people have withdrawal symptoms from tobacco use. So they have to take tobacco to relieve or avoid withdrawal symptoms. Let's look at the symptoms of tobacco withdrawal. Symptoms of tobacco withdrawal. These are things like severe irritability. People become very irritable when they stop smoking or when they can't find cigarette to smoke. Is very classical. They also have severe frustration tolerance, poor frustration tolerance. So little things that they will not bother about, that normal, regular people will not bother about, is very frustrating for people who smoke cigarette if they can't find it. Also, another symptom of tobacco withdrawal is severe anger. People get unnecessarily angry for no clear reason. Another symptom is anxiety. People feel very anxious. They are very nervous. They can't. They're very nervous. They're shaky. Anxiety symptoms. They also have difficulty focusing, difficulty concentrating. So they get easily distracted. They cannot. They can't focus. It's very difficult to stay focused to do anything. When they are withdrawing from cigarette or tobacco, there's increase in appetite. So you see someone who normally would just eat a little, they eat more and more and more. So these are some of the symptoms. And some will feel very restless. Restlessness, they have depressed mood, or they have difficulty sleeping. These are some of the side effects or some of the symptoms of withdrawal from tobacco use. Now, some of the risk is also known that when tobacco is chewed, it could also cause oral cancer, cancer of the throat, cancer of the gum, cancer of the tongue and mouth. So these are some of the symptoms that we look at. Now, the question is, how does nicotine, which is the active ingredient in tobacco, how does it work? It is known that when we smoke tobacco, as you smoke it and inhale it, nicotine is released and is carried in the smoke that you inhale into your lungs, where it is absorbed into the blood vessel and is carried to the brain. Also, when nicotine is chewed, if you chew it, what happens? If tobacco is chewed, the nicotine that is extracted from the tobacco leaf is absorbed through the mouth, the oral mucosa, and it's absorbed into the blood. And once it hits the blood, it goes straight to the brain. Once the nicotine hits the brain, it attaches to some receptors. Receptors are like end plates where chemicals or neurotransmitters are released. So when nicotine attaches to these receptors in the brain, it brings about release of dopamine. Dopamine is a chemical or the neurotransmitter in our brain. When it's released, we feel pleasure. We have pleasurable effects. We feel good. And also we know that dopamine is one of those neurotransmitters or chemicals. When it's excited, when it is released, people feel happy, people feel good, people feel high. And that's why when people do cocaine, PCP, amphetamines, dopamine is also released, and that's why people do those things, to keep their mood up. Nicotine has been shown to bring about release of dopamine in our brain. So what happens when dopamine is released now, or when nicotine gets to the brain and dopamine is released? You induce stimulation and pleasure. So you become stimulated and you feel good. That is a pleasurable effect. And when I sent a post out this morning, asked, what do you think is the reason why people feel good when they do, when they smoke cigarette or when they chew tobacco? That is what happens. They have this pleasurable feeling from from smoking a cigarette, because dopamine is released and people feel good. Also, it is known that when dopamine is released, it reduces stress and anxiety. So people feel a little calmer. It's ironical. So when dopamine is released, or when nicotine hits the brain, it sends a feeling of calmness, and it reduces stress. Nicotine is also known to modulate levels of arousal. That means it keeps people active. That's why sometimes when people feel tired, slowed down, or they're driving, they feel tired and sleepy, they pull over and they smoke a cigarette. Or when people are working and they feel so low and tired, they head out and they smoke a cigarette, they come back feeling good and up again. So it increases our level of arousal. Nicotine also affects mood control, because it brings about release of dopamine as well as norepinephrine, which is one of those neurotransmitters or chemicals that bring about fight and flight. So it stimulates people and people feel good and up to go. It also brings about release of serotonin. So nicotine affects different neurotransmitters, and that is why people smoke sometimes. Nicotine has also been shown to improve concentration to some level. So it helps with concentration. It may also help with reaction time. And that is why when people are driving, they're draggy, they're sleepy, they're tired, they smoke a cigarette, they're more active, they're more alert. So they can react quickly to activities. Nicotine has also been shown to help with performance in certain tasks. So when people are doing some things, they're feeling like they're not up to it, they smoke a cigarette or they chew some tobacco, or some people generally have tobacco in their mouth, even though it's messy, it looks nasty, but they keep it in their mouth, and that way they feel up, they feel stimulated, and it keeps them active. So what happens when you quit smoking, when you quit doing cigarette? Then there's a problem. These effects that we have will be reversed. People go through withdrawal. When people go through withdrawal, you have opposite of these effects of cigarette smoking. So what happens? People continue to smoke to get one, the pleasurable effect, and to avoid the withdrawal symptoms. So these are some of the reasons why some people smoke, to avoid the withdrawal symptoms and also to get the pleasurable effect. At this point, I'd like us to take a little break so that we can prepare our questions and we can call. But I want to recognize, I see Dwight, I also see Cher Brown, Dr. Chigozie. Thank you all for tuning in at this time. Cookie and all the other people tuning in, thank you for tuning in. If you have a question, please you can call on WBGR Radio 301-429-9247, 301-429-9247, or you can also send your questions to our Facebook page and we can discuss it. Don't go away, stay tuned. We'll take a short break. Thank you.
Policy do this? Call Forecast Financial at 1-800-678-2045 to receive a free DVD that explains how living benefits can benefit you when you need it most.
My brother had a stroke. He's finally getting better. He was able to get money from his life insurance to help cover his medical expenses. Does my insurance policy do this?
If you've had a critical illness, some life insurance plans let you take advantage of your benefits while you're still alive. Does your insurance do this? Call Forecast Financial now at 1-800-678-2045 for your free DVD. Don't wait until it's too late. Call 1-800-678-2045 today. That's 1-800-678-2045. Forecast Financial. Plan for the future now.
Have you been looking for a new car? Godwin Motors has got you covered. Check out their credit stimulus package sales event. 100% credit approval, regardless of credit, and emergency lenders on hand. Godwin Motors is located at 9071 Lanham Severn Road in Lanham, Maryland, 20706. Log on to the website at www.godwinmotorsonline.com or call 301-577-0400. That's 301-577-0400. That's Godwin Motors, and let them know you heard about them on WBGRsports.com. Are you looking for a warm and caring dental family that can cater to all of your needs? The Michael Family Dental Team is knowledgeable and sensitive.
All right, guys, welcome back to Dr. Gilead Show. We are talking about tobacco-related disorders today on WBGR Radio and on Facebook Live. We've talked about how to possibly make a diagnosis of tobacco use disorder. We've also looked at the symptoms of the withdrawal and also why people use tobacco. We've also looked at some of the problems that could occur from tobacco use. Now, how do you treat someone with tobacco use disorder? How do you treat someone who has tobacco use disorder? It is a very difficult disorder to treat, but people must be willing to get treated. That's the primary, the key. people must be willing to get treated. Once they're willing to get treated, then it becomes easier. So the question is this: when someone has smoked cigarette for a long time, for years, they've developed dependence on it and also tolerance, so they have to smoke more. There are some treatments out there, and a few things have been approved. Number one is nicotine replacement therapy. Now, because people have nicotine addiction, and they do it by smoking cigarette or by chewing tobacco. So, how do you help this person who has always gotten nicotine in their system every day? You can imagine someone who smokes about 4 packs of cigarettes a day, and that is 80 cigarettes, 80 in 24 hours, which means every 5-10 minutes he's smoking a cigarette. He smokes cigarette till he or she goes to bed. That is a lot of cigarette. That is a lot of nicotine going into the body. So what do? There are nicotine replacement therapy that have been approved. Number one is a patch. What happens is, on this patch, nicotine is infused into that patch, and the patch is placed on the skin, and you have slow absorption of nicotine into the body. That way, the nicotine is slowly released into the body, absorbed into the blood, and the person still gets the pleasurable effect of nicotine without the danger of smoking cigarette, without the danger of chewing tobacco. That way, the tobacco chewing, which could cause oral cancer, cancer of the mouth, cancer of the tongue, cancer of the throat, or cancer of the stomach, esophagus, all that will be avoided. Or smoking cigarettes, which can also predispose people to cancer, as well as cardiovascular, heart diseases, as well as lung diseases, because as you smoke, you inhale the smoke, it goes into the lungs. Gradually, it thickens the lungs, the lining of the lungs. The lungs can no longer expand and contract. When you breathe in, the lungs expand, and when you exhale or you breathe out, the lungs relax. But for someone who's been smoking so much, what happens is the lung linings become so thick that it cannot do that, expand and relax anymore. So they have, and the airways become so narrow, so they have chronic obstructive pulmonary disease. They can no longer breathe deeply, and that's why you see some of those people with oxygen tanks, and they breathe in just a little bit. Just a little bit, and that's the only way they can get in enough oxygen to circulate in their body to help send enough oxygen to the brain and the other organs in the body. So, nicotine patch has been developed, and what it does is releases nicotine slowly. The other nicotine replacement therapy is nicotine or Nicorette gum or nicotine gum. So people chew the gum like a regular gum, but the gum is infused with nicotine, and as you chew it, it's absorbed through the mouth and also through the gastrointestinal tract. So nicotine is slowly absorbed into the body, into the bloodstream, and that helps replace the nicotine, and you don't go through the withdrawals, but you also get the pleasurable effect of nicotine in the brain. The faster way of delivering nicotine to the brain is a nasal spray or the inhaler. So you spray the nicotine. You spray the nicotine infused in spray into the nostrils, pump, and it goes. You inhale it in, you breathe it in, and it goes through the lungs, and it's absorbed into the blood. There are also nicotine lozenges. These are lozenges, you suck on them, and nicotine is slowly released into the body, and people have the good feeling of nicotine without all the problems that can occur from chewing tobacco or smoking cigarette. There is a medication, well, there are two medications that have been approved for to reduce smoking or to help people who want to quit smoking or quit chewing tobacco. Number one is bupropion. Bupropion, also called Wellbutrin. Now, how did this come about? It was observed that some vets, were used, Wellbutrin was used to treat vets, war veterans who were depressed. It was noticed that when they were put on this antidepressant called Wellbutrin or bupropion, they gradually cut back on how much cigarette they smoke. That was amazing. So research was started, and it was found that Wellbutrin has a very good effect in the brain in such a way that it could help people quit smoking. Now what happens is Wellbutrin increases the levels in the brain of dopamine and norepinephrine. That way, it stimulates the effect, it simulates the effect of nicotine on this neurotransmitter. So remember, when you smoke cigarette or you chew tobacco, nicotine goes to increase the dopamine level or norepinephrine level. These are two neurotransmitters or chemicals, as I call them, for simplicity's sake, in the brain. Once dopamine is increased or norepinephrine is increased, the good feeling from using tobacco or nicotine comes into effect. It is also known that bupropion or Wellbutrin also has some nicotine receptor blocking activity. That means there are receptors in the brain, as I said before, where nicotine attaches. It's also been shown from research that Wellbutrin could block the activity of nicotine on those receptors. So what happens is when you are taking the medication Wellbutrin and you smoke cigarette, the pleasurable effect you have is not there. Cigarette does not taste good anymore. So people find out that they're just wasting their money buying cigarette, number one. Two, they are exposing themselves to medical problems, cancer, lung disease, by smoking a cigarette from which they have no pleasure anyway. So what happens is people quit smoking. So Wellbutrin, which is called bupropion, an antidepressant, is one of those medications that has been shown to help reduce the desire to smoke cigarette or chew tobacco because of these effects it has on nicotine receptors as well as the effect it has on the brain. We also know that another medication called Chantix. Chantix has been approved also as one of those medications that help in preventing or reducing cigarette smoking. How does this work? Chantix is a partial agonist of dopamine. That means it also partially increases dopamine effect. Dopamine is the chemical we talked about, the neurotransmitter. So Chantix slightly increases the effect of dopamine, but it also blocks the effects of nicotine that is added to the system. So when you take Chantix, it increases the dopamine effect slightly, but it blocks the effect of nicotine. So overall, if you smoke cigarette or you chew tobacco, it has no effect. It does not affect you anymore. The good feeling that you have is gone. And the desire, the cravings to smoke cigarette, you don't have it anymore. And so that is why Chantix has proven to be one of those medications that have good effects. Now, what does it do? How does it do this? It antagonizes, which means it blocks what we call nicotinic receptors. These are the receptors that enhance, that affect, that make, that give good, pleasurable effect of nicotine in the brain. So Chantix blocks this effect, and it's been shown to be very helpful to people that want to quit smoking. Remember, you have to be really willing to quit smoking for some of these medications to work for you. And once you're willing and you are able to take the pills, you feel better. The danger with nicotine replacement therapy is if you smoke cigarettes while you are doing nicotine replacement therapy, you get a double dose of nicotine. And the danger is you could have a heart attack, because nicotine has been shown to increase cardiac effect, increase cardiac contractility, the rate at which the heart pumps, and it could also cause vasoconstriction. It could also cause narrowing or constriction of the blood vessels of the heart. So if you're going to do nicotine replacement therapy, you cannot smoke cigarettes with it. That is the danger. But with Chantix, you can, the teaching is you can smoke some cigarette along with Chantix, and over time drop off cigarette smoking and continue to do your Chantix. And it's been shown to be helpful. I have a few patients who I have on Chantix, and they've done well. They've done real well. I've also had patients who I'm treating for depression, and they come back, they tell me, hey doc, this medication you're giving to me seems to have made it difficult for me to smoke cigarette. I don't feel good about smoking cigarette anymore. I don't like the taste of cigarette. So I'm cutting back on how much cigarette I smoke. This is how these three medications work. Before we continue, I want to say, hey, thank you for tuning in, Pauline Rosemore, Victor, Yabo, Rick Perry, Tara Clark, Anne Maria, Margaret, Roberts, and Gloria. Thank you all for tuning in today. We're talking about tobacco-related disorders. If you have a question, please send us, ask your questions. You can call. If you're in the area, you can call on WBGR Radio on 301-429-9247, or you can also send us a message on our Facebook page, and we will broadcast it, and we'll let everybody know. If you have a question, please feel free to ask. If you have a contribution, also ask so that we bring it up so other people can benefit from your information. So that's the medication treatment of tobacco use. Also, we have what is called personalized nicotine addiction treatment, because it is known that tobacco use is hard to quit. There are people who have who genetically are predisposed to smoking cigarette, and that means they have inherited, or they have genetically gotten cigarette addiction or nicotine addiction from their parents, familial. So it is hard to quit. So what the treatment, the personalized nicotine addiction treatment, is a treatment modality where you meet with the patient, talk with the patient about their nicotine use, look at what their situation is, what is the nicotine doing for them, what is it that they benefit from smoking cigarette or chewing tobacco. Once you have that, then you can formulate a treatment modality based on what their needs are. There are people who smoke cigarette because, one, they are on some medications, some antipsychotics, whether it is haloperidol or other atypical antipsychotics that are used in treating psychosis. Now, these are medications that block dopamine. Dopamine is the same chemical we talked about. So, because these medications block dopamine, reduce the amount of dopamine in the blood or in the brain, people feel down, tired, unmotivated, no drive to do anything, no pleasure in doing anything. And once they find out that when they smoke cigarette, they feel better. They smoke, and the tendency is to smoke more and more. Why? Because nicotine increases the level of dopamine. And it brings back that pleasurable feeling that they have when they smoke, when they were not on the medication. So what happens, it's been shown that once people increase the amount of cigarette they smoke, they become psychotic again. Why? Because the nicotine they smoke affects the amount, increases the dopamine in their system. Dopamine rise will cause psychosis, will make them to hear voices. So the nicotine will make them more sick. And when they become more sick, of course, the doctors will increase the medication. Also, we've known that when people are in hospitals, inpatient hospital, they are on medications, they do well on those antipsychotics. And they do well on a very low or minimal amount of medication. But once they are discharged from hospital, they start smoking cigarettes. What happens is, once they start smoking cigarette, the nicotine increases the level of dopamine in their body, in their brain. Then the low or normal amount of medication that they were doing well on while they were in hospital will no longer be effective. So you say, well, this person was doing well while he was in the hospital. How come he comes out and he becomes sick again? So it becomes a revolving door. So what I do is, when someone gets discharged from the hospital, they come to me the first time shortly after discharge from the hospital, and they do well. And they come back to see me in 2 weeks, and they're psychotic again. I sit them down, I take time, take a good history to find out what has just changed. Did you start smoking? Oh yes, I started smoking cigarette. I smoke about 2 or 3 cigarettes a day. Really? You think you're smoking about 10 to 20 cigarettes a day? Oh yeah, I smoke as much as I can get. That clinches the diagnosis or the reason why they just got sick again. So I teach my patients on why they just got sick. So I'm left with 2 options. Number 1, you need to cut back on how much cigarette you're smoking or completely quit smoking. Or number 2, I increase the dose of the medication to overcome the effect of the nicotine that has released or caused release of more dopamine and making my patient sick. So this is classical. And once you increase the medication, they feel better. Or once they cut back on how much cigarette they're smoking, the voices will go away. It's magical. It is classical. So doctors, practitioners, you need to teach your patients on the effect of tobacco use, cigarette smoking, nicotine use generally, whichever way, the effect of these on their treatment, on the medications they are on. That way they can feel better. Once people know that the effect of nicotine, the tendency is to cut back on how much nicotine they are using. So that's why we do the personalized nicotine addiction treatment. Now, there is also recently approved the electronic cigarette. The electronic cigarette, it was shown, there was a study that was done. 48 people were in this study. And these were people who did not want to stop smoking, but they were willing to try something along with their cigarette smoking. Among the 48 people, it was noticed that after an 8-week trial on the electronic cigarette, 21 of them quit smoking cigarette completely. 21 people quit smoking cigarette completely, and they continue to do the electronic cigarette. So that is positive. It shows that the electronic cigarette works. Now, what is the long-term effect of the electronic cigarette? We're yet to find out. We are yet to find out because it is completely new. People are doing it, and no one knows how this will turn out in the future. But also, it's been shown that young people, adolescents, who never smoked cigarette, were not smokers in the past, who started doing electronic cigarette, it was shown that shortly after they started smoking cigarettes. So what is that? Could it be some psychological effect of the cigarette, whether electronic or regular cigarette, on the lip or the puffing? So no one knows, but there is some psychological dependence on that develop over time when people who never smoke cigarette start using the electronic cigarette. Also, we know about individual psychotherapy. In individual psychotherapy, which could be cognitive behavioral therapy, people meet with their therapist and they look at why they smoke. How did you start smoking? Why do you smoke? What does smoking give to you? When you chew tobacco leaves, what does it do for you? People say exactly how they feel, and the therapist will look at, will also review the problems that can come from smoking a cigarette or from chewing tobacco. So once people are informed of the dangers that can happen from smoking a cigarette, or once they are informed or well informed about how to quit smoking a cigarette, and they make a promise that, okay, I smoke 20 cigarettes a day, I'm going to cut back to 18 or 15 by the time I come for my therapy next time. Or they write down how they feel, the cravings they have that makes them go to smoke cigarette. They write them down, and they look at it when they come back with their book for CBT, cognitive behavioral therapy. They sit down with the therapist, they look at what or why they smoked, and they look at how they could have stopped smoking for that particular time, or how they could have cut back on how they smoke or how much they smoke. Gradually, they begin to cut back until they completely quit smoking. So that is individual therapy. It's also known that group therapy could be helpful. Group therapy is done when a group of people who smoke cigarette come together, just like any other group therapy for substance abuse, nicotine addiction, either by chewing tobacco or cigarette smoking. People come together in a group and they discuss the problems they have in common. People who have quit, who are staying clean from nicotine, will bring ideas on how they were able to do it, how they have been able to maintain sobriety from nicotine. Others will learn from it. And people are held accountable when they relapse. And I talk to a lot of people who are in groups for substance abuse. They feel so ashamed when they relapse. And there are incentives. People graduate from one color to another, from red to orange and to green, as the case may be. And once you relapse, you drop back to red. And nobody wants to drop to a lower level more than from where they had graduated from. So people do a lot to stay clean because there's a group effect. The group effect helps sustain them, and they stay clean as much as they can. That is how group effect works. So people stay clean, and it helps them a lot. And if you do a combination of medication, whether it's Wellbutrin or bupropion or Chantix, along with individual therapy or group therapy, that is what gives the maximal positive effect. And a lot of people quit from smoking cigarette. It's not going to be easy, but it is. It takes a lot of determination, a lot of work, a lot of commitment. It also takes a lot of support from the group members, a lot of support from the care provider, a lot of support from family and loved ones. This combination of treatment modalities will help anybody quit if they are determined to quit using tobacco. Now, for individuals, as a matter of advice and support, for individuals who have been smoking, it is clearly known that nicotine tobacco is the most common cause of preventable cause of death in developed world, because they can cause cancers of different types: oral cancer, tongue cancer, lung cancer, GI cancer, stomach cancer, as well as chronic lung diseases, cardiovascular diseases, heart attacks. These are all well-known problems that can occur with cigarette smoking. So it is advisable. We are all encouraged to stop smoking cigarette. I did smoke cigarette before, but as a doctor I felt it was stupid. Why would I advise people to quit smoking and I am smoking? It did not make sense to me. So one day I just quit smoking. It was not easy, but I did. And I have not smoked cigarette for since 1995, and that will be 22 years. It's a good feeling. That is my candid advice to people who smoke cigarette or chew tobacco. Number two, for families, it will be a good support for your family member who keeps smoking. And a lot of people have quit smoking because their spouse says, you got to quit smoking or else I'm not going to marry you anymore. Or if you don't quit smoking, we're not going to get married. Sometimes that doesn't work. It's more punitive. But positive reinforcement works. Say, hey, you need to quit smoking so we can do this. That helps people to quit, other than a form of punishment. Or, hey, if you don't quit smoking, you're not going to have sex with me anymore. That is punitive. It does not work. The person is going to get his action somewhere else. So families should support. If your children are smoking, education works. Try to educate them on the difficulties and problems that come with cigarette smoking. There are helplines for people who want to quit smoking. You can call the helpline, Google it. There are different programs out there. And in Maryland, in PG County, we have in Maryland, as a matter of fact, all over we have the a nicotine addiction support group, and the state can pay for initial doses of Chantix, and you can get well. So it's really a good thing to quit smoking because of the problems that this can cause. Today, I want to say thank you for tuning in on Dr. Gilead Show. We've talked about tobacco use disorder, the problems that can come from it, ways of treating it, but it is not easy, I can assure you, but it's doable. You can quit if you are determined, and the earlier you quit, the better.